Hello, my name is Dr. Christina Canody. I am a pediatrician with BayCare Medical Group and the medical director for the pediatric service line at BayCare. So we ask that children wear masks basically to prevent them from spreading their respiratory secretions into the environment. We wear masks to protect the people around us, not necessarily to protect ourselves, and that's the important part of community education. For people who are not able to wear a mask because they have underlying breathing problems, for kids with texture issues or other sensory disorders, it's important that those around them wear one to help protect them, but in general, the person wearing the mask is protecting others more so than protecting yourself by wearing that mask. It is important for both parties to wear them because if you think about a filter, having two filters is better than one. So not only are you filtering the secretions as they come out of your mouth and nose, but you're also filtering what you breathe in. And that's really important in preventing spread of the illness. When you're communicating to your child why they need to wear a mask, it's important to let them know it's not only protecting them, it's protecting those around them. It keeps their friends from getting sick. It's also important for parents to know to get them to use it before they ever go back to school. The three things that I've told parents all summer are: number one, get your physicals; number two, make sure your immunizations are up to date; and number three, make sure your child knows how to wear a mask. Those are going to be really important for going back to school. For children who have sensory disorders and may have difficulty wearing masks, what we recommend is, first of all, see if they'll tolerate it. Give it a try. Make it a fun game. Some will actually surprise you and do quite well with it, even though they don't necessarily like other things on their face. The other thing is kids love magical thinking. So if it's their favorite superhero or their favorite cartoon character, they're gonna love it. Every girl wants a little princess mask and everybody wants to wear their favorite character on there. You can also give kids the ability to decorate it. I've seen everything from fabric markers to bedazzled, and the kids really enjoy the ability to make it part of their own and take ownership of that. The other thing that will also help is a face shield. These can be clear plastic shields that are a little more comfortable to wear around the head, and they have a full line of vision. So that's something that you can work with your school and the teachers on determining if that's better for your child. So the main thing in determining whether you should use a cloth face covering or mask or a disposable mask is really the cleanliness and being able to have one readily available. Cloth face coverings can be very adequate for children to wear. They're also a lot more comfortable. The main thing is they need to be cleaned daily. So you wouldn't send them to school with the same mask for an entire week. You want to make sure those are getting washed on a daily basis. And the same thing with a disposable face covering. You don't want to wear it for multiple days or multiple sessions. The whole point is making sure that the inside mask is what touches your face and the outside is what collects the germs. Best way to clean the reusable mask is just to clean it with soap and water like you would the rest of your laundry. Most of them can be cleaned in the washer and dryer, or at least in the washer and hung up to dry, and that's perfectly acceptable. One thing that is important when parents are choosing a face covering, for a cloth face mask, it should be double layer. That's been proven the most effective in reducing the respiratory secretions. We also know that masks decrease those respiratory secretions by over 60% if it's a double layer cloth face covering, so that's important. One of the other kinds of face coverings that you have likely seen children wearing are what we call neck gaiters, and they're actually elastic pieces of fabric that go around the neck and can be pulled up and down. Two things that are important as they qualify as cloth face coverings. Number one is to make sure that it's a double layer when it's pulled over the mouth and the nose, and that also it's nice and firm against the chin. The second thing is when they take it up and down, it needs to actually be moved out and in and not slid up and down the face, because once again, the outside is considered the contaminated part, and if they're really touching that all over their face, they have a chance to move those contaminated particles into their own nose and mouth.